Welcome to another series of Doctor to You, helping you to be a master of your health. My name is Dr. Ahmed Kamara. Before you dive in, make sure you like, subscribe, and share with your friends and loved ones. Today I'm going to talk to you about a series of common infections and the public health recommendations about staying away from school or the workplace. The first is chickenpox, which is a very common childhood infection. Although some people develop it in adulthood, most people develop it just once in their lifetime. Some people can develop it a second time. When someone has chickenpox, the virus remains in our body eternally. And periodically, if our immune system is significantly low, the virus may reactivate, and this will present as something called shingles along a localized area of the skin. And this is because the virus stays dormant or asleep in the spinal cord, and when it reactivates as shingles, it travels along a nerve, and the skin lesions that you see in shingles are usually along the path that nerve travels. So someone is actually infected from about 2 days before they develop the rashes that you see with chickenpox, which are typically blistering rashes all over the body. The general advice in terms of exclusion is you should stay away from school or the workplace or anywhere where there might be people with low immune system, otherwise known as immunocompromised, until you're no longer producing any new blisters and all old blisters have dried and crusted over. This is the same advice for shingles and chickenpox. Now let's talk about measles. This is a very infective virus. We don't see a lot of cases of measles because of effective childhood vaccination schedule in the United Kingdom. When people do develop measles infection, typically they'll develop fever, flu-like symptoms, runny nose. They may also develop a cough, sneezing, and conjunctivitis, which is inflammation and watering of the eyes. The typical rash in measles generally starts on the face and the back of the ears before spreading to the rest of the body. If someone has confirmed measles, we usually need to report that case to the local public health team or the health protection team. That is so that they can give relevant communities particular advice. For example, it may be a school. For the person who has measles, they're usually advised not to return to work or a school setting or any other particular community setting that they usually go to until they are fully recovered from the illness. Other potentially vulnerable people, for example, pregnant women or children under the age of 1, or other children who may not have been vaccinated against measles, who may have been in the vicinity of the confirmed case of measles up to about 4 to 5 days earlier, you're usually also advised to seek advice from their GP. It is highly advisable that all children take part in the routine childhood vaccination, especially having the MMR vaccine, measles, mumps, and rubella vaccine, which is highly effective. There tend to be cases of outbreaks of measles where the vaccination uptake is lower than what the public health experts would like. Another infection to be aware of is something called mumps. Typically, the mumps virus affects the parotid glands. If someone develops mumps, they will get very large swelling of the parotid glands. In the case of mumps, the health protection team doesn't need to be informed. Any affected individual is advised to stay away from contact with others in the workplace or school setting for at least 5 days. Again, as with measles, it is highly recommended that all children have the MMR vaccine, and if someone hasn't been vaccinated, to see their GP to have a catch-up vaccination schedule. Ringworm is another common skin infection. This is caused by a fungus, and it can affect different parts of the skin. In fact, different type of fungi cause ringworm. The important thing is if someone develops ringworm, they should seek advice and start treatment. Once treatment has been started, they can actually return to school or the workplace. If someone has ringworm or fungal infection affecting their feet, it is important that they wear socks and shoes at all times. This is to reduce the spread to other people. Scabies is a very itchy skin condition caused by tiny mites that burrow into the skin. There's effective treatment for scabies. Adults in general do not necessarily need to be excluded from the workplace or school setting as long as they can keep away from making contact with other people. For children, it is difficult for them to adhere to this, and therefore it is advisable for them to stay away from school until at least 24 hours after they've started treatment. Head lice are common in children, but also amongst families in general. It is not necessarily a reflection of poor hygiene, and it is generally not a reason to be excluded from school. In fact, Public Health England advises that schools should be careful about sending out batch letters to parents if there's an outbreak of head lice, because this can create unnecessary panic and anxiety. It is important though that parents regularly check their children's hair for any mites and to start prompt treatment if any is detected. Now let's talk about gastroenteritis, or diarrhea and vomiting. And this can be caused by food poisoning of various sorts. It can be caused by viruses and bacteria. Common virus is the norovirus. Common bacteria is Campylobacter, Salmonella, or Shigella. The important thing is if someone has diarrhea and vomiting or food poisoning, otherwise known as gastroenteritis, they should stay away from the workplace or school until they've not had symptoms for at least 48 hours. The last symptom of either vomiting or diarrhea should be 48 hours or 2 days before they can return back to the workplace or school setting. I'm going to talk about Group A streptococcus infection and scarlet fever at the same time, because scarlet fever is often caused by a Group A streptococcus bacteria. In the case of scarlet fever, the patient may have fever, sore throat, perhaps even symptoms of tonsillitis with swollen tonsils and white exudates on the tonsils. They may also develop typical changes of the tongue that we describe as strawberry tongue appearance, and a typical rash, usually on the torso, the chest, the abdomen, and perhaps the back, that we describe as a sandpaper rash. Now, it isn't as rough as sandpaper. The important thing is when scarlet fever is suspected, you should stay away from school or the workplace, but you can return after completing at least 24 hours of antibiotic treatment. Now let's talk about impetigo, which is another common skin condition. It is caused by a streptococcus bacteria. It can happen anywhere on the face. It can develop as a primary infection or as a complication of a skin lesion. So for example, someone may have eczema or psoriasis or even ringworm, and these can become infected by the streptococcus bacteria, hence a secondary streptococcus infection. They'll typically have a crusty appearance. Once seen, it is forever easily recognizable as impetigo. Impetigo is highly infectious. You should stay away from school setting or workplace until at least 48 hours of antibiotic treatment. That's it, folks. I think that covers most of the common skin conditions. It goes without saying that, as well as the school exclusion, if you have any of these infections, it is important to follow strict hand hygiene measures. And for something like impetigo or ringworm, it is important to avoid sharing towels at home. For things like scabies, it is important that all household members are actually treated, as well as ensuring that frequently used clothing, bedding are washed at the highest temperature recommended by manufacturers. I hope that's been helpful. Rewind, share, make sure you like and subscribe to this channel so that I can keep doing more and more of these. Thank you very much, and I look forward to seeing you again soon.
Audio Jungle.